the Champions account will be sending out invitation. Okay, right then. So it gives me great pleasure to introduce Marion Gibbon. She's the Interim Assistant Director of Public Health in Birmingham. Over to you, Marion.
Yes, thank you very much. I'm really pleased that we've managed to get so many of you signing up for being a COVID champion, and especially at this time where we are seeing the numbers of cases rising and the likelihood of us going into a tier 3 situation is increasing. And so therefore I'm really pleased that we've got so many of you coming to join this program in order for us to get the messages that are really pertinent out to our communities in a way that they understand. Because I think one of the problems that we've been seeing is the confusion that has arisen from some of what's come down from nationally, and then how that is translated into the ground. And so having your support with this initiative will be very useful in making sure that people understand what they need to do. So what I would really like and appreciate now is a consideration how to hear your questions in order to be able to support you in some of what you need to know. But the other thing is that we know that we've got a period of festivals coming up, and how we can make sure that through those festivals people are able to be safe and to take into account how we might do those, how we might communicate in a way that ensures people are able to comply with what's needed of them. Because I know that each of the communities have got very significant festivals and commemorations that are coming up at the moment, and it's really important that we're able to spend time with our loved ones, even if it's only by virtual means, because the implications of us being lonely and isolated have an awful impact on our mental well-being as well. So I really want to hear your questions and how we can begin to support this initiative in a really good way.
So just to start off then, Marion, can you just tell us a little bit about your role in public health, especially around COVID, and some of the work that you've been doing with some of our faith communities?
Yeah, certainly. So the whole one of the things that I feel is really important with this work around the work that I've been doing around COVID is how we develop trust between organisations that are seen are not always trusted, and the work that we've been trying to do with Birmingham City Council is ensure that we have an open dialogue between our different communities using our faith leaders. And so we have an opportunity on a very regular basis for having a dialogue with our Black churches and with all faiths and Majids, all of those community leaders, in order for us to understand from their perspective what's going on the ground, and for us to start to be as provide the information in a simple way that is easily understood, and ensure that our communities are able to support themselves through making sure they stay healthy, have good immune health, and all of those elements that public health is very concerned about. The other kind of area that I've worked is ensuring that there's data that supports some of the decisions that need to be made. So we have a group of intelligence specialists who are able to take the data from the hospitals and other sources and provide it in a timely fashion, so that we know what's going on where. So which wards have got the most problem at the moment, which businesses have issues that they need supporting with. We're also working very closely with our environmental health colleagues and the enforcement team in order to make sure that if people are raising complaints and problems around others not being very helpful, that we can deal with those situations in a quick manner. So that's the kind of area of what I've been working on through this period of time.
Marion, is there a piece of work that stands out in terms of what you worked with with faith communities that's been very positive through COVID?
One of the things that we're working on at the moment, which I hope is really going to help them even more, there's been environmental health have been supporting around doing putting risk assessments together. But one of the things we're looking to do a bit more in depth at the moment is ensure that we can do some training around how to undertake risk assessments in a robust fashion, and that to give each of the settings that undertakes that training a set of posters that they can that they can utilize to show that they're a COVID safe environment. And I think that's really important because it will give the congregations a sense of security as well as the leaders in themselves.
Okay. So we're just going to open it out in terms of if there's any questions from everyone. So here we go. So this is from Sue Clegg. More generally, as the government regulations are handed down, can Birmingham add their own, and with what enforcement? I think that's going to be more around from Tier 3, Marion.
Yeah, absolutely. At the moment, the work on what's going to be able to happen within Tier 3 is currently being undertaken. So because not all of the guidance has been produced as yet, and so we're kind of looking at what possible scenarios might be in place, and looking at how we can make sure that people are supported, similar to what happened in the first lockdown.
So just to clarify, there is some standard Tier 3 precautions that have to happen, but there's some amendments that can be under discussion, and it hasn't been fully transcribed yet at this point.
Yeah.
Okay. Sharon asked about training. Sharon, can you just clarify what training that is in the chat, please? That'd be great, and then I'll come back to you. Catherine Gordon says community centres would appreciate the risk assessment. Oh, right. I think it's around the risk assessment. So community centres would appreciate risk assessment training and COVID safe endorsement posters. I can answer that in terms of the posters. I'm not sure how much is being done on that. I think that might be a Public Health England resource coming through. Marion, is there any updates around risk assessments of kind of community centres, or with your experience with faith institutions?
Yeah, well, our environmental health colleagues have been developing training, and what I'm now suggesting, because there's so many different organisations that want to have some kind of training, is that we use a webinar approach, so that we actually record it, and then anybody can access that training through their internet connection, and then it will make it much more available to many more people, and so that's the thinking that we've had around that. And I'm due to talk to Ricky and his team about how we can ensure that happens.
Yeah, so we'll probably have to discuss it in terms of timeline and cascading that out as well. So whenever that training comes alive, so yeah, we'll have a look at that and get that out. Yeah, appreciate your point there, Catherine. Sometimes the government the .gov website isn't fairly clear cut. Some things are kind of hidden away. I think it's just the sheer volume and the amount of people who've got niche sort of requests from there kind of gets hidden. And sometimes it, you know, it probably is there, but it's not very clear. But no, take your point on. It is on there. Marion, in terms of like going back to some of the faith organizations and faith communities that you've been dealing with, in terms of like moving forward, how important is our relationship or public health relationship, one with citizens and community champions like it is here, but with faith institutions and moving forward in terms of the recovery of the city?
I feel it's really, really important because Birmingham, as we all know, is a hugely diverse city with many different community groups and different faiths. And for us to get through this phase, we need to be all working together and seeing each other as allies in recovery. It's going to be a long haul, I think, with the current situation as the numbers are not going down as we would like, and the hospitals are becoming overloaded again, like they did in the first wave. And we know that the second wave of an outbreak is often far worse than the initial one. So whatever we can do to support our communities and ensure that people stay safe is really, really important. I think the what Carol is saying, Carol and Bill Gordon, there is a debate around whether we should be using the word COVID safe, because as you say, there is always a risk. And I think you're right in terms of saying mitigation. It is. I have a similar thing around social distancing. I don't think we should be calling it social distancing. I think it should be physical distancing, because we do not want to be socially distant from our communities or from our families and our loved ones. And what is more important is keeping and mitigating for the risk through using physical distancing, that we want to be able to interact with our loved ones as much as we possibly can through means like this. I think we've all come on a huge way in terms of the use of technology. I don't think that we're likely to return to our offices anytime soon. And previously, the trust given to our staff as to why working from home versus working from the office, there was a variance in that. Now we're seeing that that many places have realised that actually they get far more from their staff if they support them and they enable them to work from a home in an effective manner. So I think there's lots of changes that are happening through this period of time.
So just to kind of clarify what Marion's just saying there, in terms of the language that have been spoken is really important, and some things that could get reviewed in future in terms of terminology can also be very, very important. Chris Milton has asked a question, Marion, regarding the guidance for people speaking at front of churches and masks. If they're speaking close to the congregation, what is the recommendation?
Well, I think the thing is, if you're in a small environment, it is always better to wear a mask. If you've got an extensive environment, larger spaces, and you have mitigations in place, like the use of screens to stop the droplets, then it is all around the kind of risk assessment is incredibly important. And I think having people that are able to support risk assessments pertinent to a particular building is quite important, and that's one of the things that we're looking to try and ensure that we can do, so that everyone can have the risks of contracting COVID minimised.
Yeah. So again, it's the one from kind of like the masks is a really big one. Do you in terms of some of the guidance, Marion, do you think there's any areas that where we you know, not only just as public health, in terms of like citizens, is there a way of trying to improve communication between ourselves? What would you know, what's your thoughts on that?
I know from my previous work and working internationally as well, the use of language is so important, that you can have two completely different understandings of one word, and therefore having a dialogue and to ensure that there's a common understanding of what we're saying is really truly important. And I think that we need to be looking for ways to enable that to happen at all times, that we are honest and authentic in our undertakings, that we're not trying to cover things up and all of those sorts of things. So
yeah, no problem, Marion. I think Magda from the Polish Expats Association is just asking for a few minutes potentially at the end, or if not around the risk assessment. Is there anything that is kind of general that we can answer in this point, Magda?
So it's for an outdoor event. I'm sure you've heard about the situation in Poland and mass protests against government's sweeping ban on abortion rights. It's basically,
yeah.
So there is an event planned for this Sunday in Birmingham. Obviously, if it's approved. But you know, I'm just wondering about a few things, you know, about organizers, you know, the things that, you know, organizers of protests, political protests, you know, should take into account, you know, if there's anything that, you know, I'm missing, or perhaps I could contact one of you maybe after the session, just not to take up too much time.
Yeah, because a lot of it is around making sure that people have masks, that they are they are 2 meters distant from each other, and those are and one of the things that I think that people tend to do, because I've watched people wearing masks and they'll touch their faces with the mask on, and it's that whole thing about how do we get them to because. And the removal of a mask is quite important, because you can...
They'll pull them down to speak.
Yeah, exactly. So there's all of those things that I think we need to ensure that people understand, that pulling them down to speak is not useful. Wearing them below their nose is not useful, because you might as well not be wearing them at all. Those are the kinds of things that we need to make sure that we can get those things communicated.
Okay, what I'm going to do now is I'm just going to kind of open it to the floor. So if anybody wants to ask a question, that they can do. So we've got Marion here for another sort of 10 minutes or so. Is there any questions that anybody wants to ask at this point? If you unmute yourself and put in there. I'm going to give it another minute or so. Sorry, not a minute, probably about another 30 seconds. Okay, well, I'll kind of then ask sort of the final questions then in terms to Marion. Marion, in terms of from your experience, what do you think what's the like? If you could kind of, I know it's not definite, what do you see kind of the run up towards Christmas and slightly Christmas and after Christmas looks like?
I think we're going to have a very challenging time, and because one of the things is that people are fed up with being in this situation now, and so I think the resistance has been mounting, and that's one of the things is how can we get people to understand how do we all come together to kind of support each other and help each other. My real thing at the moment, I've been thinking a lot about this, is how do we enable caring, compassionate communities to be in existence? That some of what's going on in the media at the moment, and seeing the politics within America, is increased division and hate, and I really find that very unhelpful. And I want to be able to be in a position where we can think about how we look after each other. I know that within my team, within the council, I'm always concerned about making sure that the staff are not burning themselves out because they're working too many hours, and that they're thinking about their mental health. And I think sometimes those questions that you can ask of your friends if you feel that they're down are really, really important. If you think about the things that we do around minimizing mental health illness and prevention of suicide, those things at this time are really, really important, and that's what we need to be kind of making sure that we're intent on undertaking, rather than some of the unhelpful behaviors that have been becoming pretty commonplace.
Thank you, Marion. I know it's a very difficult kind of question, really, to kind of future forecast. So I'm just going to go to a couple of sort of last questions that have sort of come in. Just bear with me 1 second. Oh, it's just gone. So Alison was just talking about the confusion on the news yesterday, and will we be going into tier 3? So the likelihood, Alison, at this point is that there are discussions in terms of government and locally in terms of what tier 3 might look like, and if cases do continue to rise, that the likelihood is that we will go into tier 3. So Shaminda Matu comes with it. She works in a department store, and she doesn't feel that there's enough social distancing between customers and staff, and a lot of people don't wear masks. What can she do in trying to challenge this?
It's a really, really difficult question, because I know that quite often if people are asked why they're not wearing masks, they become quite defensive and sometimes can be abusive. And so one of the things that we've been offered within the council is this training around having difficult conversations, and it may be worth considering how those conversations, how kind of non-conflictual conversations that you can have to enable people to respond in a way that's not, so you're not going to get verbally abused, I think is really important.
Okay, Magda's talking about Andy Street's clarification. Yes, just to clarify, we're not in tier 3 as of yet. I think what it is just that they have their preparations or discussions that if cases do continue, what does that look like, and how would that be enforced? So it's not tier 3 at the moment. Carol and Bill Gordon have come back with a question. If we are away from Birmingham in a self-contained property in tier 1 area, when tier 3 comes in, do we have to come back straight away, or can we return after it has started?
I haven't read the guidance around that response. I would need to be fully.
What we'll do there, Carol, is we'll get the guidance clarification. So as far as we know, is whatever tier group that you're in, you take those conditions to wherever you go. So what we'll do is we'll send we'll get some clarification of that guidance and send it through. We're going to be sending out an update this afternoon, so we'll put that guidance in this afternoon's update for you.
And with regard to what Chris Milton asks about when we go into tier 3, if we go into tier 3, it's a similar thing, because they're saying that you should stay in the tiers that you are, and and holidays at the moment are considered non-essential travel. So, but we need to look into that a bit more.
Yeah.
Non-conflict.
Sorry, Cynthia. I think Cynthia's got her mic on. Just bear with me 1 second. There's yeah, Shaminda, I don't know if there's any recommend training in terms of conflict management, especially with customers. I think that's an organizational response as the store that you're working with, in terms of their risk assessment and their policy that they have. So I would speak to your employers at this point in terms of having those non-conflict conversations and diffusing training. I think that's what the police have call it, diffuser training. So it might be something that could be highlighted at that point. Okay, so the last one is this is from Janet Cannon. Sorry, I can't see either way. I've heard from a well-respected funeral director that people with COVID are allowed to attend funerals. I was very shocked by this. Has he been misunderstood?
Yes, I would say that he has misunderstood.
Yes, if they have tested positive, they should be isolating. They shouldn't be going out. In terms of for attending funerals from the exemption, I'm not aware of that exemption at this point. But again, it'll be something that we'll add to the guidance in this afternoon's update. Okay, Marion, what I'm going to do, we'll close the session from now, just to give you guys a bit of an update in terms of materials and resources, what you should be expecting. So on Tuesdays, hopefully you've been getting the weekly your weekly dashboard data. That was giving you sort of your week on week rolling week numbers in terms of infections and just general stats from the city around COVID. You should be getting a couple of texts a week, maybe just some key points to redirect you, some resources that you can kind of pass on. This afternoon we'll be sending you some more updates, hopefully some translated guidance in tier 2, which we've just had completed, and that kind of gives it the tier 2 guidance in several languages. Okay, so that one's there. Next week on the 4th, we will be having a session. We'll be doing a Q&A with Justin Varney, and hopefully some of the questions that have been mentioned today can be. We'll probably have a lot more detail as well at that point. Just the last couple of questions I could just see here. So sorry about during lockdown. And this is from Magda. A lot of people wiped all their purchases with antibacterial wipes. Sorry. I've just had one of my daughter has just come into the room. Just bear with me 1 second. Sorry. During the lockdown, a lot of people have wiped all their purchases with antibacterial wipes. Do you think this is a bit over the top?
The problem I have with antibacterial wipes is that they're antibacterial, not antiviral. So not actually very much beneficial. What's better is to leave your purchases for a certain amount of time, and before you collect them in, because antibacterial, it's antibacterial, not antiviral. And good also, water is absolutely superb for your hands. It's much, much better than any wipe that you could utilize.
Yeah, no product endorsement there, Marion. Thank you very much. And the last question is, what I'm going to say is from Sharon, is if a church hasn't had the information that some of the other churches have had or been working with, how do they access it? So what I'll do is I will send you Habib Ullah, his email address, and he coordinates some of the faith meetings, and we can invite you into there, Sharon, if that's okay.
One question just before we end, sorry.
Yes, Grace. Go for it.
So in terms of the potential switch into being into tier 3, you mentioned that there might be specific rules that are more general to Birmingham. Is it the case that there will be there's overall guidance for if you are in tier 3, which is of course not going in other people's gardens and it's essentially not leaving Birmingham. But did you mention that there would be other areas of guidance that would be specifically to Birmingham? I hope that makes sense.
It does make sense, Grace. And the planning for if we go into tier 3 is currently taking place. So at the moment, I can't answer that question. It's only once we know what's happening that will become clear.
Okay, totally fine. Would that be circulated to us in the form of emails and alerts? I'm just wondering how that might be available specifically to people of Birmingham.
Yeah,
Ricky, it'll be on the website, won't it?
Yeah, so if there's any changes to happen immediately, obviously the best place for us to go is the Birmingham City Council corporate website, and obviously on social media. That's probably the fastest way of information breaking and spreading out. But as soon as there's any changes, we'll be sending out the information to all to the champions as well. So try not to believe anything that we're trying to hoard information and try and stop it. This is this format of actually having champions is we're trying to encourage people to get the latest information out there, because many of us ourselves are citizens in the city. So we want to make sure that we want to give everybody the best answer.
Yeah,
totally makes sense.
Yeah, and to try and stop some of the false information that's going around as well. So we want to make sure that you get the best available information and advice, not some of the scaremongering and false information that's going around.
Yeah, totally makes sense. Thank you.
Magda, on your antibacterial wipe, we'll try and get you some of the correct guidance. Otherwise, that we're going to get stuck in terms of like chemical makeups of products as well. So, yeah, as with anything, you have different kind of hand sanitizers and different wipes and etc. with different things. So, if I make a sweeping general statement, it doesn't mean it's applicable for everything. So, we won't give you which products, but there's a few things that you can have a look on that that the products contain kind of 1 million particles per whatever it is on in terms of bleach and things like that. So I'm not saying wash your hands with bleach, guys, before you do anything with that. I'm just saying there's different things. Okay, so
soap and water is still the best.
Yeah. For 20 seconds, make sure you keep washing your hands and sing happy birthday as you're doing it.
Thank you.
Okay then, guys, I'm going to close it at this point, but thank you very much for meeting today. We are going to try and with Justin, his availability is more towards the end in an evening. So here's one wherever we can mix it up with different kind of guests, we will at different times. It just gives a lot of people a different opportunity. So we'll be sending you guys the invite for the 4th of November with Justin at between 6 p.m. and 7 p.m. next week. Have a safe evening and a great day. Enjoy Halloween as safely as you can, and we'll get together next week. All the best.